Salam and hello everyone. Welcome to or welcome back to the channel. I hope that you are all doing very well. For many of you watching, you understand that between 70 to 80% of all women will experience fibroids, especially before menopause and during the reproductive years. But there are certain risk factors that can make fibroids more likely to appear as well as cause them to grow larger. So in today's video, I am going to be talking about these risk factors and what you can do about them. So I hope it's going to be an informative video for you. If you are experiencing fibroids, if you think you are experiencing fibroids, if you know someone who is experiencing fibroids, this information will help get you started into thinking about ways in which to limit your risk as well as attack your fibroids and treatment in a very aggressive and productive manner. So I hope this video is going to be beneficial for you all watching. So let's dive in. So the first is high blood pressure. Now in epidemiology, in 2005 study, research showed that women with hypertension had a higher risk of developing fibroids. Now this is important because chronic high blood pressure may damage blood vessels and promote abnormal growth of the uterus. If you're managing blood pressure with lifestyle changes or medication, you may also be protecting your uterus. So it's going to be important for you to be careful of your diet. Number one, check out this video on foods that can naturally lower your blood pressure. And then number two, also consider eliminating foods that do increase blood pressure, such as foods that are high in sodium, that are high in salt. That's another thing you can do. And then number three, make sure to get your blood pressure checked. Many of you don't know that you have hypertension or are at risk for hypertension. So it's going to be important for you to know where you stand. I've created a specific video on the silent killer hypertension. I want you to watch this video because many of us don't know where we stand, and it's really important for us to know where we stand with regards to our blood pressure, and also understand ways in which we can reduce our risk, not only through food but also through stress management. So I want you to take a look at this video before and understand that high blood pressure is a risk for fibroids. Now the second thing I want to talk to you about is obesity. Now there are multiple studies that confirm that obesity increases the risk for fibroids. Higher fat percentage or higher body fat percentage equals higher estrogen production, which fuels fibroid growth. And this was found in Obstetrics and Gynecology International in a study published in 2008. This matters for women, especially after 40, because our weight tends to creep up in the perimenopausal stage of life. We have an imbalance of our hormones. We see a lot of belly fat. We see just so many things going on with our bodies, and obesity is one of them. Obesity is in the top 5 ailments that are responsible for death in women. So it's going to be important for us to understand how we can control our weight, how we can control our eating habits, and even a small amount of weight loss, 5 to 10%, can help reduce risk factors, not just for fibroids, but of course heart disease, diabetes, hypertension. It's all related. Comorbidities exist more and more, I should say. There's a prevalence of increased comorbidity. So that means a woman will have hypertension and diabetes, or hypertension and obesity and diabetes. So multiple diseases together. We really need to understand what's going on and how we can combat that, because it's going to be really important for us, especially as we get older. Now, the third risk factor I want to talk to you about is vitamin D deficiency. Now, if you've heard me talk about vitamin D deficiency, thank you. That means you've seen some of my previous videos, because women with low vitamin D levels are significantly more likely to have fibroids, and that was found in a study in epidemiology in 2013. This matters because vitamin D helps regulate cell growth. It's important for immunity. It's important for bone health, and it may slow fibroid development. And watch this video here in which I talk specifically about the mechanisms behind how vitamin D3 works. Please check your vitamin D levels. Make sure you get that checked out. You'd be surprised. Some of you are really low in vitamin D, so you may want to supplement with a capsule or liquid vitamin D every day, or go out and get some sun. Most of us need to supplement because we're not getting enough sun, or we're not eating enough food that's been fortified with vitamin D. So please think about getting your levels checked, and also, get your levels checked and then think about supplementing if you need to. Now, the fourth thing I want to talk about, the risk of having a family member with fibroids. I don't think we talk about genetics enough. Having a mother or sister with fibroids can increase a woman's risk for fibroids up to threefold, and that's found in the New England Journal of Medicine. Why it matters is because genes may influence estrogen metabolism and uterine tissue growth. So if fibroids run in your family, you'll want to be proactive with getting yourself a full evaluation from your medical provider, including screenings and symptom monitoring, and ask. Some families are secretive with this information: cholesterol, high cholesterol, high blood pressure, hypertension, fibroids. We don't talk about it enough in our families of what's going on. Some of you may not even know your mother experienced all these symptoms because the mother is not open with what she experienced, not knowing it can be passed down to her daughters. So please try to get as much information you can and talk about these things amongst your family if you can. Now, a fifth symptom for increased risk of fibroids includes high stress. So chronic stress increases your cortisol levels, which can disrupt estrogen and progesterone balance and worsen fibroid risk. Stress is often highest in midlife amongst women between 40s and 50s and 60s because there's a career to manage, family to manage, a lot of things going on. And with all of those interpersonal relationships happening all at once, and in addition to what's going on with our health, it can cause a lot of things to be out of whack, a lot of things to be imbalanced. So it's going to be really important for us women who are of a certain age, and even if you're younger or older and experience this, to please practice stress reduction techniques. That could be sleeping 7 to 9 hours at a minimum. That could be mindfulness and relaxation techniques if you haven't already started to implement. It could be just taking a moment for yourself to maybe walk, to turn off all devices and give yourself in your mind a time to breathe and to relax, as well as doing some deep breathing and trying to find ways to monitor your stress and support your hormonal balance. Now, the sixth risk factor for developing fibroids or increasing your risk of fibroids includes your exposure to a lifetime of estrogen. So what that means is, how much estrogen have you been exposed to during your lifetime? Number one, did you get your menarche or your period early? Were you around the age of 10 or 11 years old, and then you're still having periods up until 40, 50, and some 60-year-old women have their menarche still? Number two, have you ever had a child or given childbirth? If you haven't, that means that you are also being exposed to more estrogen. Usually when pregnancy or childbirth occurs, it reduces fibroid risk because you have some hormonal shifting that impacts your uterus. So women who haven't been pregnant or haven't been or who are actually exposed to more oral contraceptives that contain estrogen, for example, are, of course, at a higher risk, for example. Now, this is just a risk factor that many of you can't change. Many of you have chosen not to have children, or some of you have not been able to have children yet. So that awareness is really important for you to know that increased estrogen exposure is actually a risk factor. Again, remember, fibroids is due to hormonal imbalances or an increased hormonal exposure of the estrogen and progesterone hormones. Now, let's talk about the seventh risk factor on the list, and that is race and ethnicity. So even though 70 to 80% of women experience fibroids, African American women are 2 to 3 times more likely to develop fibroids, and that is seen in especially younger women of younger age who are African American. And often women who experience this at a younger age have more severe symptoms. So Asian women also have a higher risk compared to white women, and that was found in fertility and sterility. Genetics, vitamin D metabolism, and environmental exposure all play a role. So it's going to be important for you to know your risk. Again, familial history has something to do with it. It's linked to family having a history of fibroids. And then also just understanding that when you see your provider, and if you are of African descent or Asian descent, to please advocate for yourself and push to have not a certain treatment, but an option. Know your options for how to treat fibroids, because I know a lot of women who have been commenting on some of my past and new videos have said that they want to treat their fibroids naturally. And I holistically support you in treating it holistically with natural remedies. But understand that there are times when natural remedies are not going to reduce a certain type of fibroid. It could be a fibroid that is outside of the uterus, or it could be a fibroid that is just so large that it is causing complications and it is actually preventing you from doing certain things, whether it's trying to have a child or to just live a healthier and better life. So please check this video out here, because I want you to understand how fibroids are treated with medication, surgical options, as well as herbal or supplement remedies. I use the word treatment. Just know that with supplements or herbal remedies in the United States, you can't technically say they are treatments because they're not FDA approved. That's just the language. I want to make sure that I'm clear on that, because if it's not FDA approved, which no supplement or herbal remedies are, then you cannot state the claim that it treats or it uses or is being used for a specific reason, either to shrink or to eliminate fibroids, for example. And now the eighth risk factor that I want to talk about, the eighth and final risk factor that I want to talk about, is women who are over the age of 40. So you might be thinking, well, I'm reaching 40, I'm exiting those reproductive years. And while I agree, we see that the risk for fibroids peaks in women's 40s before declining after menopause, which we see there's a reduction of estrogen and progesterone. And this happens because of this fluctuation in hormones. We're seeing that fibroid growth is accelerated during this time because our hormones are so out of whack. And that's the only reason why we see a peak in the 40s. And I said earlier, women in the reproductive years between 30 and 40, it's most commonly seen there, but there's a peak in the 40s. Now, even if you didn't have fibroids before, it can appear in your 40s. So it's going to be important for you to just do your due diligence, monitor your body, understand the different symptoms of menopause, not the symptoms of menopause, but the symptoms of fibroids. And I'll leave a link to this video here that talks about, could the symptoms you're experiencing, could it be fibroids, and also certain things you can do to help yourself prepare for your doctor's visit. So I'll leave this link here for the video on that, so that you have a better understanding what the symptoms of fibroids could be. So while you can't change when you started your menstrual cycle, how much, exposure to estrogen you've had over your lifetime naturally, as well as family history or your race, you can try to influence things like your blood pressure, your weight, your diet, your nutrition, how you exercise, your stress levels, your vitamin D level, your vitamin D exposure. So small steps can help make a big difference in managing your overall health and your risk of fibroids. So I do hope this information, or the information that I presented to you in this video, has been very helpful for you. Please let me know in the comments what you would like to discuss regarding fibroids. I thank you for watching, and I shall see you in the next video. Take care. Bye.